Hey everyone, welcome back to Dr. Tripathy YouTube channel.
A shadow across millennia, the enduring threat of tuberculosis. Tuberculosis, the very word evokes a chill, a whisper from centuries past, a reminder of a disease that has plagued humanity since the dawn of civilization. Its skeletal hand has touched countless lives, leaving a trail of suffering and death across history. From the crowded slums of ancient cities to the battlefields of modern warfare, tuberculosis has been a constant threat, a shadow lurking in the background of human existence. Even in our age of medical marvels, tuberculosis remains a formidable foe. It is a disease of poverty and inequality, thriving in crowded conditions and weakened immune systems. Despite significant advances in treatment and prevention, TB continues to claim millions of lives each year, a stark reminder of the fragility of human health. The fight against tuberculosis is far from over. It is a battle waged on multiple fronts. From the research laboratory to the community clinic, from the halls of government to the homes of those affected. It is a fight that demands our unwavering attention, our collective will, and our unwavering commitment to global health equity. It is a fight we can win, but only if we recognize the enduring threat of this ancient scourge and resolve to finally break its grip on humanity. The microscopic enemy, understanding Mycobacterium tuberculosis and its transmission. Tuberculosis is caused by a bacterium known as Mycobacterium tuberculosis, a tiny rod-shaped organism with an outsized impact on human health. This microscopic enemy possesses a unique characteristic that makes it particularly difficult to eradicate: the ability to lie dormant within the body for years, even decades. This means that an individual can be infected with TB without showing any symptoms, unknowingly carrying the potential for disease within them. Transmission of Mycobacterium tuberculosis occurs primarily through the air, making it a highly contagious disease. When an individual with active pulmonary TB coughs, sneezes, or even speaks, tiny droplets containing the bacteria are expelled into the environment. These droplets can linger in the air for hours, potentially infecting anyone who inhales them. The structure of Mycobacterium tuberculosis further contributes to its resilience. The bacterium possesses a thick, waxy outer coat that protects it from many common disinfectants and even some antibiotics. This unique characteristic makes it difficult to eliminate the bacteria once they have established an infection. Understanding the biology of Mycobacterium tuberculosis is crucial for developing effective strategies to combat this ancient foe. By unraveling the secrets of its resilience and transmission, we can develop better diagnostic tools, more effective treatments, and ultimately, a world free from the threat of tuberculosis. A global crisis. The burden of TB and its impact on vulnerable populations. Tuberculosis is not merely a disease, it is a global health crisis. It is a leading cause of death worldwide, claiming millions of lives each year and disproportionately impacting the most vulnerable among us. While TB can affect anyone, anywhere, it thrives in settings of poverty, overcrowding, and limited access to healthcare. The burden of TB falls heaviest on low and middle-income countries, where resources are scarce and health systems are often ill-equipped to effectively diagnose, treat, and prevent the disease. Sub-Saharan Africa in particular bears a disproportionate share of the global TB burden, accounting for a significant percentage of new cases and deaths each year. Marginalized populations, including those living in poverty, migrants, refugees, and individuals with compromised immune systems, are also at increased risk of contracting TB. These groups often face barriers to accessing healthcare, including stigma, discrimination, and lack of affordable treatment options. The fight against tuberculosis is inextricably linked to the fight for social justice. Addressing the underlying social determinants of health, such as poverty, inequality, and lack of access to education and healthcare, is essential for effectively combating this global crisis. Section 4. The seeds of infection. How TB spreads and who is most at risk. Tuberculosis spreads through the air, making it a highly contagious disease, but not everyone who inhales the bacteria will become sick. The risk of developing active TB depends on a complex interplay of factors, including the intensity and duration of exposure, the strength of the individual's immune system, and the presence of other underlying health conditions. Close contact with someone who has active pulmonary TB is the most common route of transmission. This is why TB is often referred to as a social disease, as it thrives in settings where people live and interact in close proximity, such as households, prisons, and homeless shelters. Certain groups are at increased risk of developing active TB after being infected. These include people with weakened immune systems, such as those with HIV/AIDS, diabetes, or malnutrition. Young children whose immune systems are still developing, the elderly, whose immune systems may be weakened with age, and people who live or work in crowded conditions such as prisons, homeless shelters, and healthcare facilities. Understanding the factors that contribute to TB transmission and identifying those at highest risk of infection are crucial steps in developing targeted interventions to break the cycle of this disease. Section 5. The body at war. The immune response to TB and the development of active disease. Upon entering the lungs, Mycobacterium tuberculosis encounters the body's first line of defense, the immune system. In most cases, the immune system is able to contain the infection, preventing the bacteria from replicating and causing disease. This is known as latent TB infection, a silent infection in which the individual does not experience any symptoms and is not contagious. However, in some cases, the immune system is unable to completely eradicate the bacteria. Mycobacterium tuberculosis has evolved sophisticated mechanisms to evade the immune system, allowing it to persist within the body, often for years or even decades. This creates a state of latent TB infection, where the bacteria remain dormant but have the potential to reactivate and cause disease if the immune system becomes weakened. Several factors can trigger the reactivation of latent TB infection, including HIV infection, malnutrition, diabetes, smoking, and certain medications that suppress the immune system. When reactivation occurs, the bacteria begin to multiply rapidly, leading to active TB disease. Active TB disease can manifest in various ways, but it most commonly affects the lungs, causing symptoms such as persistent cough, chest pain, fever, and weight loss. If left untreated, active TB can be fatal.